welcome back to our podcast with Dr. Johnny. This is episode 2. And first of all, Johnny, I just want to ask, what do you offer?
So as a pain medicine consultant, I offer the opportunity for patients to be seen quickly and efficiently, and really for me to evaluate all of their history and what their chronic pain brings to their everyday life. So that's probably the starting point, a really focused history and examination with the patient. But on top of that, there's probably 3 key areas where perhaps the Manchester Pain Clinic differs from what you might get normally. So the first is that sometimes patients can be really complex or have long histories, and I work within what's called an MDT or multidisciplinary team. And what that is essentially is a group of experts from lots of disciplines who work together closely with me. So that might be, for instance, a neurosurgeon, a neurologist, or a rheumatologist, and someone who looks at images called a neuroradiologist. And all of those people work together with me so that we can break down even the more complicated cases and offer patients a bespoke solution, targeted diagnosis and treatment for their pain. So that's one of the key areas where it differs. The second is that we have access to some cutting edge technology. So I offer lots of treatments for a range of mechanical pains as well as nervy type pains, so things like sciatica, nerve root issues, and mechanical pains. So lots of what are called ablative technologies, or technologies where small nerves are burnt away to offer pain for mechanical conditions. So that might be things like arthritis affecting your shoulders, which might not be amenable to surgical treatment, hips, knees, backs, and lots of other areas. So that's probably the second area. And then the third is the onset of advancing technology, which is coming to the Manchester Pain Clinic, which is to do with what's called neuromodulatory technologies, or technologies that are involved in modifying the way that nerves work, sometimes using artificial intelligence or implants, those kind of things, and really harnessing the power of technology to try and help us move patients forward with a range of conditions, especially for nerve type pain.
All of that is what the Manchester Pain Clinic offers, right?
Yes, that's correct.
So that's essentially multiple opinions under one roof, isn't it?
Exactly. So that's quite a unique thing to be able to offer, particularly in the private medicine world.
Mm-hmm.
So within pain medicine, often it's the sort of it's the confluence or the watershed area, I guess, where you get lots of different specialties and lots of different conditions feeding into pain medicine. So that might be neurosurgical conditions, it might be sports exercise or sports injuries, it might be rheumatology conditions, it could be any of those. And sometimes the patients do need to have the best possible opinions all combined together. So it might not be something straightforward like sciatica, for instance. So within my practice, I'm able to work with all of these other specialists who work within that same roof, if you like, that same umbrella of practice. And that means that you get all those opinions delivered to you as a free service. So if you came to see me and we needed to bottom out some other aspects, we would all work together behind the scenes and then deliver our combined opinion to you so that I could then take your care forward myself as part of the Manchester Pain Clinic offering.
From a patient perspective, I know it's more reassuring to know that, a couple of people have worked on your case and that you know that you're going to get that personalised treatment.
Yeah.
Okay.
So, yeah, you're right. The MDT is very much a combination of expert opinion from lots of different people, not for all patients, but maybe for the more complex patient that offer that availability of the MDT. Expert opinion's always there.
Mm-hmm.
But the technology is more my day-to-day practice in terms of what we're bringing to patients. So that might be for hip and knee pain, it might be for back pain. So it might be things like what are called radiofrequency technologies or denervation treatments, which patients can access. And we do have excellent kit for that. So involving either lots of heat or lots of cold to treat nerves and change nerve pathways so that patients won't feel pain. And that can be for the young and old for a range of conditions, for back pain, for instance, leg pain, hip and knee pain. And then you've got the more advanced technologies, which we're bringing in as well in terms of neuromodulation technology. So technologies which involve the use of small currents, electrical leads, and sometimes artificial intelligence and implanted technologies in future.
Would you say you're looking forward to implementing that into
Yeah, it's
treatments?
really exciting. So the field has excellent evidence, and I'm well networked across the UK and Europe with lots of people who are involved in that field. So it's quite a small niche area within pain medicine, but it's a really exciting field involving lots of really sort of world-leading developments in terms of technologies, companies, as well as medical doctors, and it's something that we're really looking forward to bringing into my practice in the Manchester Pain Clinic.
I mean, it sounds like it'll be a really good addition to what you're already offering.
Yeah.
Do you find that there's a lot of misconceptions with what you offer, or is it quite straightforward to the patients and clear?
I think pain medicine is an area which a lot of people don't understand. So a lot of people, fortunately, won't have heard of pain medicine, or might have heard of maybe pain management, where they'll go to maybe an NHS centre and or they'll go to see a physio, maybe get some exercises, and maybe some pain relief, and that will be sort of a way of managing and coping with what can be a very distressing and disabling condition. But actually, with targeted technologies, with bespoke management, which can range from either medicines or the technologies I've talked about, or sometimes for some patients, just help from excellent networks with physios or the psychologist that works with me, can really change a patient's outlook, their pain, and if not pain, sometimes function. So it really depends on the patient. And I think pain medicine is something which hopefully we'll be able to bring to the fore, so that more patients are aware of what pain medicine is, what we offer, so that they don't potentially have to go through this more protracted route of seeing their GP, for instance, lots of other people before eventually filtering into pain clinic, maybe short-circuiting that journey for them to speed up their treatment and hopefully speed up recovery.
I had no idea the difference between pain medicine and pain management, but I feel like you've really helped me understand that. So hopefully you're helping listeners understand that as well.
Absolutely.
Going back to neuromodulation technologies, how new is that?
So neuromodulation has been practiced in some way, shape or form since 1967, using some quite primitive and outdated looking kit, and it's gradually developed over time. And I would say over probably the last, certainly in Europe, in the last 10 to 15 years, it's really started to push forward, as we see that really strong evidence for improvement in quality of life, really good cost benefit in terms of patients' return to work, reduction in morphine use, those kind of things on the bigger scale. But also for the individual patient, these technologies are so advanced now in terms of the way that they can treat nerves, in the way that the technology itself has shrunk in size, and things like very simple things, a bit like a mobile phone really, much easier to charge. Battery life is a lot better for devices, and just a lot better at targeting the structures that you need to target. So really, I guess we're probably reaching the point where there'll be more of an explosion in these technologies in terms of how they're used and what patients they can be used for.
Going forward with the newer technologies and newer treatments that you're going to be offering, how can you ensure that that's going to be safe long term for your patients?
So I'm quite lucky. I have a mixed NHS practice, and as I say, well networked within the field. So I'm lucky in the sense that although there's a relatively small number of people doing this, we're all connected together. So there's a big research and clinical community within the field. And also we work closely with the various medical device providers to make sure that we're using the best technology, because they're all slightly different. So the best technology that really fits the patient the best. So bespoke use of technology for the right technology for the right patient at the right time.
When you're making your personalised treatments to each patient, how do you get across that it's so important to focus on the pain long term than short term with these technologies and treatments?
So often with chronic pain, for some of these treatments, patients have have I say, bounced around the system for quite a long time.
Mm-hmm.
And so setting expectations with the patients about what they can expect from our treatments
Mm-hmm.
is really important. And some pain conditions do have to be managed longer term. Some can be relieved or cured, but some have to be managed. And it's about trying to find the best management tool for the patient. So that's not always medicines.
Mm-hmm.
It's not always just solely physio or talking therapies, but sometimes it can be. And sometimes it's about intervening at certain times. And so trying to maximize the benefit and minimize or mitigate as much of the risk as possible around any treatments, be that medicines,
Mm-hmm.
be that the use of interventions, is really important.
And then, just out of interest, say one of your listeners wanted to reach out to you. Can you walk me through the process of reaching out to potential appointment? Could you just tell me a little bit more about how you'd go about it?
Absolutely. The easiest way probably for a patient to contact us or find out more about the services that we offer is to have a look at the Manchester Pain Clinic website.
Mm-hmm.
So that's probably port of call one. And it's also very easy to call my secretary or the practice manager. So that's another way. Or you can email us via the website or contact us through social media or at one of the many private practices and hospitals that I work out of in Manchester.
For example, say I reach out, what's the next step?
So the next step tends to be that you get a friendly conversation with my practice manager, Will, and he will tend to find out a bit about your problem, find out if you've got any information that you want to send in before your appointment, if you want to make an appointment, and he'll try and fit in with your schedule as to availability. And sometimes, because he's quite experienced, he'll be able to fit in maybe your first appointment and maybe schedule any follow-ups or any other sessions with you so that can be done together. Perhaps you need to have a scan and we can maybe sort out your scan on a certain day with follow-up on the same day, particularly if you're traveling from further away, so that you don't have to come repeatedly, or maybe schedule in some telephone calls as well. So really just trying to make it as easy and seamless a journey for the patient.
Well, thank you so much, Dr. Johnny, for speaking with us today. And then for listeners at home, if you want to find out any more information about the Manchester Pain Clinic or Dr. Johnny, head over to the website and also keep up to date with the podcast. More episodes to come.